We've been looking to partner with a top advanced diagnostic global player, if you like, for a little while now. The Marsden has a very good clinical diagnostics laboratory. We are, in fact, the regional hub lab for North Thames, which is one of the 7 regional hub labs in England for delivering genomic testing. But we want to take it beyond that. And obviously, apart from delivering standard of care, we also want to push the boundaries of new developments, research, and generally trying to implement the best and most advanced clinical diagnostics for our patients. And as part of that, we've been looking around to try and find a partner that we can essentially install a functional laboratory that will be able to deliver that for example, for clinical trials particularly, and for some of our private patients as well, with a view in the longer term, hopefully, to learning from that and implementing that perhaps in the NHS as well. I think the advantages of partnering with us, and we partner with Guardant Health. Guardant Health are a major leading international advanced diagnostics company. They have lots of resources. I think they complement the specialities that we have here really well. The Marsden's internationally recognised for obviously for its cancer care. But also for its diagnostics and for the integrated and the setting up of clinical trials and the running of clinical trials here. To partner with someone like Guardant brings us a lot of extra resources, a lot of expertise that we wouldn't necessarily have in-house all the time, and a really high delivery level of quality that I think is absolutely essential, so that we know that we're not just delivering the most advanced testing available for patients, but also that we're doing that at a really high level of quality. So the lab we've set up is very monitored. It's to super high standards, and we know that we're working with Guardant that we're probably going to get the best we possibly can from that. And furthermore, by working with a company like Guardant, we hope to again be in advance. So with new technologies, new methodologies, they have a lot of resources to develop new tests that will be in the driving seat, if you like, for being able to apply those tests in new trials, so that we can get those things kick-started really quickly. So that we're not having to hang around and think about how we're going to develop a test, that we'll know that in advance, and that it'll make us more agile to move into a clinical trial field, because we'll already be working with Guardant on new developments from that. I would also like to obviously say that it's not our only way of delivering testing. We have our own laboratory here, and we have great expertise here. We have our own liquid biopsy testing going on. This is about really having a full portfolio of tests that deliver comprehensive testing, but for all the different circumstances that we might come across. So it's essential to us in the Marsden that we have knowledge and expertise in-house. We're not just buying things in without knowing what they do. We're buying things in this instance, or partnering, I think, in this instance, because we know what they do. We know that it complements what we're doing, but we'll carry on doing what we want to do as well, and building complementary tests to what we're able to deliver there. It's a little bit like saying, we've got a limited set of resources, and we're going to put our resources into what we do really well, and we're going to work with Guardant in this case to be able to offer those kinds of advanced diagnostics, because that's what they do really well. First of all, the facility's got to be operational for the trial work and everything that we're doing first, and that's going to probably take 6 to 12 months, I would think. I would like it to be 6 months. Reality tells me, in my experience, that things always take a bit longer than you expect them to take. We've signed the agreement. We know what we need to do. We've got the space. We've got the we've got the money to buy the equipment. So we'll be setting that up and recruiting the staff and so on. And as I say, we're building on a platform that's already quite a strong platform of knowledge and the correct workflows, obviously, with all our properly accredited laboratory and pathways. So this is a proper diagnostic ISO accredited lab, and everything will be set up to those standards. So in order to do that, validate the equipment and tick all those boxes, that will probably take us at least 6 to 9 months, I would think. The first phase then of testing will then of putting that into real practice will be about delivering for our own patients in the hospital, and also for clinical trials we hope to be setting up. With the information that we're getting from that, and with complementary information that we'll be generating both through our own tests and also through collaborations with our colleagues, other GLHs around the country, we'll be putting together, hopefully, a really good and strong case that liquid biopsies should be put into practice more widely in the NHS. On the NHS question, I think there are already a few tests that we can deliver. We're paid to deliver, if you like, by NHS as a liquid diagnostic. But it's not as comprehensive as we'd like, and we've been working, not just ourselves, but the other GLHs, the other genomic laboratory hubs, with NHS England to put together a very strong case to say that, look, blood testing for cancer is coming. It's going to happen. Patients want it. Clinicians want it. It's really important. And I think the scientific case for that is extremely strong, and they accept that. I think what we've really got to demonstrate now to the NHS is that this gives them, proper cost benefit, benefits patient, and benefit for money. And I think by running the facility that we're running now in the rapid turnaround manner that we will be doing, we'll be turning samples around within 7 days, which I think is a phenomenal turnaround time. We'll be able to demonstrate the feasibility of doing this. It's not just about the science of it. It's about showing that actually, look, it works and we can actually do it and actually benefits patients. So probably for the first year, I should think we'll be generating that kind of data. We'll be sharing that with the NHS England. And then it will be about, the NHS England themselves negotiating with companies and making sure they get it for a good price. Because not only obviously do you want to benefit patients, you've got to do this at a price the NHS can afford. So this is really about building capacity, building knowledge, building experience, and showing how it can be done. And then hopefully getting that in. And in the meantime, the trial work and the private work that we do will be subsidising, generating that kind of information, hopefully to enable a much broader application. And in the end, at the minute, obviously we have a Guardant. This isn't, we partner with them for reasons I've gone into already. I think it's a proof of principle, isn't it? So that we hope it will be a competitive market down the line, and we hope that competition will drive not just prices to be affordable for NHS provision, but also to drive development of new, better, more sensitive tests. So it's one of these things where you just have to accept that things are going to take a little while to get to demonstrate the full utility of them, but you've got to make a first step, and I think that we've made a bold step here at the Marsden. It's I don't think, I'm not aware of anybody else doing this kind of partnership with an advanced diagnostic company before. We do think that this is a positive thing and a good thing to be doing, and we're very optimistic that it's going to deliver good benefit for patients.